Hello everyone, I am Martina here, behavioral therapist at WELL Rehabilitation Network. Today we are going to see about what is behavioral therapy and how it can be useful for autism, ADHD and neuro-developmental disorders, and some of the techniques today we are going to see. So first, what is behavioral therapy? Behavioral therapy encompasses strategies for modifying problem behaviors. The idea is to reinforce positive ones while removing the negative ones. So the goal is to focus on the problem behaviors and how it can be changed into positive ones. The mainly goal is to implement the skills relating to the behavior. How it can be useful for autism, ADHD and neurodevelopmental disorder. When we talk about this, we will first see how it is beneficial for the kids. First we have to identify their problem behaviors. Such as in which they are lacking in the problems. For example, we have to identify their level of understanding, attention span, cognitive skills, then stereotypes patterns, then reasoning. First we have to identify the problems and we will later work on that. Then now I am going to tell about some of the techniques which will help improve their behavior regarding to that. First we will see about modeling. When we talk about the modeling is helpful to kids to shape a new behavior by imitation primarily to observation, which means it is helpful to learn new behaviors, the copying of someone else. For example, first we will shape the building blocks and ask the child to build this from this copying of this building blocks. So it will helpful then for eye-hand coordination as well. Then the other technique is token economy. When we talk about this token economy, it's like a reward to shape behavior. For example, we will ask the children to shape the behavior when they have the desired behavior. For example, the desired behavior is nice hands. At that time, we will give the token coins to the kids, but not grabbing items. When they have the desired behavior as nice hands only, we will give this token coins to them. Then other technique is systematic desensitization. When we take about the systematic desensitization, it is exposing the kid to fear-provoking situation from most scary to least scary. For example, if a child is fearful for dogs, we will show them the picture of the dog on the computer or phone. Later, we will make them pass along a dog park and then even actually build them closer to the dog themselves. The other technique is social skills training. Social skills training is a form of behavioral therapy. It helps kids to learn interacting from other peoples. When the kids have difficulty in facing with other peoples, this technique will helpful to mingle with other peoples. For example, eye contact we will make them eye contact during conversation, and we will smiling when greeting new peoples, and we will ask them to shake hands when meeting other peoples. Like this we will go for the kids to interact with other peoples. And then the other technique is Prima principle. Prima principle is like a motivate a kid to help in to participate in an activity. For example, if a kid does not want to do the activity, we will participate in an activity. For example, we will motivate a child like this. First you brush your teeth, then you can play your video games. First you will finish your homework, then we will go to park. Like this we can encourage the people, encourage the kids and motivate them this way. And the last technique is time out. When we talk about the time out, generally it's like we do not allow them to do prefer items or prefer activities at a specific amount of time. For example, when we talk about this time out, if a child is playing and suddenly they hit their siblings, we can make the child to sit alone for 2 to 3 minutes. This can implement, and the best way to implement time out. So these are the techniques will improve the behavior of the child applied in according to this behavioral therapy. Thank you from WELL Rehabilitation Network.